Okay, so what about these precautions in terms of not spreading um, an infectious disease? Well, there's contact precautions, and that's typically for, say, an infectious rash. Say someone has impetigo, right, which is a superficial infection of the skin. Well, that's going to be contact precautions. MRSA can also cause infectious skin symptoms. So a MRSA infection or a MRSA abscess, so methicillin-resistant Staph aureus, that would be contact precautions. You wouldn't want to directly touch the rash of MRSA, right? Diarrheal illnesses are contact precautions. Um, Open wounds. So open wounds again would be contact. How are you going to spread it? By touching it, or a healthcare worker touching it and then touching something else, right? So that would be contact precautions. So hand hygiene, wearing gloves, uh, gowns to avoid transmitting the disease. Droplet precautions are from typically respiratory conditions, right? So droplets typically don't travel too far. They travel a meter or two and then they drop because they're in larger droplets. So colds, diphtheria. Uh, so most of us are immunized against diphtheria, which is a infection of the back of your throat with a bacteria. Um, won't see it very often because most of us are immunized. Influenza is droplet precautions. The plague you're not going to see very often. Uh, that's caused by a bacteria called Yersinia, but not common at all. Strep throat, that'll be droplet. Meningitis can be droplet because often they have the infection within their lungs as well. Meningitis is an infection of the linings of around the brain, the meninges, but often they have respiratory symptoms as well. Mumps is infection and inflammation of the parotid salivary glands. Okay, so swollen salivary glands on each side. So they have a really swollen face. Mumps can often affect uh, this can lead to sterility because it inflames the ovaries or the testicles and can lead to infertility and sterility. Pertussis is whooping cough, another droplet transmitted disease. RSV, respiratory syncytial virus, is common in children um, and can easily be spread through droplets. Okay, so just know your airborne precautions. So hand hygiene for sure, because you could have acquired the droplets on your hands, and wearing a mask. Okay, airborne just means that the infection has the ability to travel further in the air. That's it. It can go further than droplets. Okay, so you could actually think of airborne as tiny little droplets that have gone further. I don't I don't like this distinction, but it exists. Okay, so here's some examples of airborne precautions. So tuberculosis, chickenpox, because chickenpox isn't necessarily just on the skin. It can actually be a respiratory illness as well. Measles, I know you have a rash with measles, but you have a respiratory condition with it as well. Okay, so droplet precautions, you can see there's more: hand hygiene, surgical mask, gloves, gown. Okay. Okay, so I think these slides will go much faster because we've spent some time already talking about these conditions. So laryngitis, we won't spend much time on. It's inflammation of the larynx and the vocal cords. People typically have um, decreased ability to talk, a very hoarse voice, maybe some throat pain with it. And typically it's from a virus from overuse of your voice, and it's voice rest and lots of fluids to keep the vocal cords hydrated. Okay. Um, Influenza, we're gonna talk about coming up soon. There's two forms. There's seasonal influenza, which is what we typically deal with. So in the fall and winter months is when influenza typically comes through. Why? People are close together in the winter months, right? They're aggregated together typically, especially in colder climates. Or you can have a pandemic of influenza where it just spreads across the world. Okay. We typically know which strains, or we try to predict which strains are coming through for the upcoming year because we can look at other countries that went through their winter. So Australia and other countries, we can see which strains went through there, and we can try and predict which influenza viral strains are coming through for the upcoming winter. Okay. Pneumonia we're going to talk about. Sure, they can be classified into two groups. Community-acquired pneumonia, meaning you got it somewhere in the community, at home, at school, wherever, outside of the hospital. And healthcare-associated pneumonia, meaning you acquired the pneumonia after admission to hospital. So you got it within the hospital setting. And one of those examples of healthcare-associated pneumonia would be ventilator-associated pneumonia. So after being intubated and put on a ventilator, one of the complications is developing a pneumonia, right? You have a foreign tube in your trachea that's breathing for you. And that's a risk factor for developing ventilator-associated pneumonia. Oh, okay, well here's laryngitis again, so we'll talk about it in a bit more detail. So laryngitis, most of them are acute laryngitis, and most of those are caused by a virus. Okay, so someone comes in and they can't speak and they have a hoarse voice, that's typically from a virus, very rarely from a bacteria. Okay, so we don't use antibiotics typically for it. What are some other causes of laryngitis? Well, GERD, so you're refluxing acid, typically while you're sleeping, up to your vocal cords. And then the acid touches the vocal cords and gives you a hoarse voice. Okay, so GERD can actually cause laryngitis. Overuse, so you go to a concert, you're screaming like everyone else at the concert, and the next day you have laryngitis. Okay, so what are the expected findings? A hoarse voice, or aphonia even, meaning I can't talk at all. Some people can just have a simple mild tickle in their throat, but usually if it's affecting the vocal cords, it's going to be hoarseness, and if it's really severe, aphonia. Okay. What medications do we use? Not many usually, because the vast majority are not bacterial, they're viral. Okay. Could we use corticosteroids to treat this? Well, if someone has ongoing inflammation of the vocal cords and their voice just isn't coming back and they're hoarse all the time, we could try corticosteroids to try and reduce the inflammation. So, sure. Remember, most viral laryngitis will just resolve on their own with fluids and voice rest. Okay. What else can you do? So I mentioned voice rest, mentioned fluids, humidifying the air. So putting a humidifier in the room that the patient sleeps in. Advising them to stop smoking because smoking irritates the larynx and the vocal cords. Okay. And of course, laryngitis is made worse by cold air. So when you're breathing and cold air hits this irritated vocal cords, it causes people to cough and because of the irritated vocal cords. Okay, so what about influenza, or what we call the flu? So when somebody comes in and says, I have the flu, most of the time what they mean is, I have a cold. Because the majority of people that have cold symptoms, cough, bit of sputum, achy joints, it's typically a viral infection, such as an acute bronchitis. Okay, but patients that come in that are significantly ill with really severe muscle aches, weakness, coughing, shortness of breath, then we may consider testing for influenza. Okay, not that there's much we can do about it because the antiviral medications aren't very effective. Okay, So very common in the fall and winter months. So we're looking at September until April. Very contagious. Okay, so typically a day before getting any symptoms at all, so that's the incubation time or the incubation period where the person has no symptoms, and typically 4 or 5 days after they have symptoms, they're contagious. And as I mentioned, these patients are miserable. Severe headaches, muscle aches, weakness, fatigue, fever, um, and they can be hypoxic. Why? Because influenza, one of the complications of influenza is influenza pneumonia. And when it attacks the lungs or it gets down as low as the lungs, it can cause problems with oxygenation. And that's why some people die of influenza, because they get pneumonia and they end up on a ventilator, or they just die of respiratory arrest. Okay. So remember, this is droplet precautions and contact precautions, right? Because people are coughing and the virus is landing on fomites, on furniture, on a desk, or all kinds of things. So it would be droplet and contact precautions. So we encourage fluids, right? We monitor intake and output to make sure that they're getting enough fluids. And what's the best way to know if someone's getting enough fluids? Well, you can either see them drinking the fluids or you can monitor urine output, because urine output is a very good indicator of overall hydration of the patient. Okay. And of course, monitoring respiratory status is important, right? So if they're breathing at 30 or 40 per minute, they're not oxygenating well, we're starting to get concerned that they may be developing influenza pneumonia. I mentioned the antivirals such as amantadine and another very common one that you may hear of called oseltamivir, which is Tamiflu. Countries stockpiled oseltamivir, thinking that they might get a pandemic influenza. But now we know the medication really isn't that effective, and it has significant side effects such as severe diarrhea. And it has to be taken typically in the first 24 to 48 hours. So not really that useful. Okay. The influenza vaccines can be very effective for mass vaccinations. Okay. And there's a new influenza vaccine that comes out every year that's based on prediction models of the influenza strains that are coming through. Okay. So you can have it from 6 months onwards. But typically patients that have high risk features such as a history of pneumonia, diabetics, patients over the age of 65, pregnant women, healthcare providers, they're highly encouraged to get the vaccine because they're at higher risk for getting influenza. Okay, so this slide's expected findings I've already spoken about. Remember, this is all from a viral illness, so no need for antibiotics with influenza. There's diagnostic tests, so nasopharyngeal tests where we put that swab right to the back of the nose, take a sample, and then send it off for viral studies for influenza. Okay. There's also rapid influenza tests that can be obtained to get a result even more quickly. Influenza comes in two versions, influenza A and influenza B. Influenza A tends to be a more severe illness compared to influenza B. Okay, so how do we minimize the spread of influenza? Well, we try to remind people to get their annual influenza immunizations. Proper hand washing and avoiding coughing on people is pretty critical. In fact, in hospitals, there's people that walk around seeing how staff are washing their hands to see if it's being done properly, because it's actually a bit of a skill to really wash your hands properly. Okay, so proper hand washing and cough etiquette. Avoiding places where there's lots of people gathering, especially in the winter, right? That's a very good way to get influenza, where you're gathering with large populations. Okay. If you do have influenza, so encouraging fluid intake, lots of rest periods, and staying at home so you don't spread it to other people. Okay. I mentioned the main complication of influenza, which is influenza pneumonia. Who's at risk for getting that? Well, patients that are immunocompromised, so they're on, say, chemotherapy drugs, or they have a disease where they're immunocompromised, they're more at risk for getting influenza pneumonia and then potentially dying from that. Older patients, of course, are at high risk because we consider them immunocompromised, right? Their immune system is starting to weaken over time, and their pulmonary function is not as strong as it used to be. So if they were to get influenza, their lungs are weaker to begin with, so it might hit them harder, and they're immunocompromised on top of that. Okay, so in the interest of time, I'm not going to spend much time on this slide. We spoke about the droplet and contact precautions. We spoke about maintaining proper hydration, monitoring input and output, administering fluids. Respiratory status is important. So someone who comes back having been diagnosed with influenza, and now they're short of breath, they're weak, their O2 sat is in the 80s, say it's 85%. Then we're going to do a chest x-ray to see if they have influenza pneumonia, and they'll likely need to be admitted to hospital. Okay, and some patients end up on ventilators. I mentioned the antiviral medications. It can shorten the duration of illness by 6 to 12 hours. Usually we don't use them anymore because that's a pretty short length of time to shorten the illness with significant side effects such as nausea, vomiting, and diarrhea. Okay. The flu vaccines are critical to try and prevent this, even though they're only, say, anywhere from 20 to 40% effective. When you're vaccinating large populations, that's still a very useful vaccine.